Ladies and gentlemen, we would like to carry on our program with a presentation from Kolan Hospitals Group presentation. Dr. Alim Yusupov will be with us shortly and will do, I think he's already with us and ready to go ahead with his presentation. The floor is yours to do a general presentation for the Kolan, and after you, we will have a Professor Dr. Sadık Yıldırım. I believe he will be following you. Thank you.
Всем здравствуйте.
Yeah, okay, you can share the screen actually.
Одну секунду. Всем здравствуйте, меня зовут
Good afternoon to all of you. My name is Ali Yusupov. I am a surgeon. Currently, I work in the international clinic Kolan. Over the time I work, actually, I studied all the details about our clinic. Kolan Clinic has 7 offices, 2 centers are located in Istanbul, and 2 of those are in the northern Cyprus. 1 million patients are admitted every year in our clinics. Kolan Hospital tries to develop all the new technologies and to introduce new diagnostics methods, as well as we provide high quality and safe medical services to our patients. The largest hospital is in the city of Shishli, 20 minutes drive from international airport in Istanbul. The cost of treatment is 50% is lower compared to European medical facilities. Treatment in Kolan hospitals is provided based on the international protocols. We have our tertiary specialists, and they consider the case as a team. So we here also are equipped with advanced equipment, PET-CT, positron emission, computer tomography, and others. For the international citizens, patients are accommodated in rooms. The cost also includes placement of 1 person accompanying patient. We have also provide transfers from the airport to the hospital and hotel. Also, our patients will be met, will be accompanied and accommodated in the hotel, or whether they will be taken directly to the hospital. We also get the international accreditation of the Joint Commission, International Joint Commission. It means that our clinic could provide services at the highest international standards. A meeting in the airport, you can book your airport. You can book your air tickets. You can be placed in single rooms. You can be allowed, your relatives will be allowed to visit you. It is important to mention the unit of orthopedics and traumatology. We specialized on treatment of different defects of the bone muscular system. Pediatric orthopedics also is developed. We treat scoliosis, Pertus disease. Quite recently, we had a boy, 14 years old. He had scoliosis, 4th grade. 1 month ago, it happened. He was treated with surgery, and surgery was a success. The patient was discharged from the hospital in good joints replacement and treatment. Also, we employ minimum invasive surgeries. Arthroplasty also is employed. With this, we restore the function of joints. Also, when necessary, we replace joints. Normally, the cut is only 11 centimeters, depending on the brand of the implant. The lifetime of the new joint prosthesis will be 20-25 years. Also, rehabilitation facilities are available at our clinic. It is important to mention that at our neurology and neurosurgery unit in Kolan Hospital, we treat epilepsy, Alzheimer's disease, Parkinson's disease, disseminated sclerosis. Also, we have many surgeries for different patients. Also, we rehabilitate patients with different malignancies, both in brain and in the spine. Surgical treatment is available for patients who have malignancies in spine and brain. Our neuronavigation systems allow us to see the real position of the tumor. Transplantation of bone marrow also, we have a specialized unit of bone marrow transplantation. We have very safe rooms because they have very low immunity status. Procedures are employed here both with malignant and non-malignant diseases of blood. With allogenic transplantation, normally we take cells from the patients, pre-allogenic, autogenic, allogenic transplantations. Then in this case, cells are taken from the donor or the close relative of the person who is compatible by the features with our patient. Bone marrow transplantation. Quite recently, we had two persons who applied to us, 2 boys. We examined them and we plan to have bone marrow transplantation for them. Our vascular surgeons, we have a very good team of vascular surgeons. One of the surgeons is engaged in surgery almost every day, and Normally, this surgery takes 3-4 hours. It's very difficult to get to him because after the surgery, he has the hours when he sees the patients. Also, surgery of heart valves. For us, it's important to identify what sort of problem we have. And then we can do the valve plasticity and replace them. All this as well here, we do all valve restoration in our units. Cardio surgeons in our clinic are one of, they have an experiment, it's an experimental plot, our clinic, where we control the quality of the aorta valve replacement outcomes. And for us, it's important that it is not surgery treatment. Organ transplantation, kidneys, liver. Radiation oncology. Radiotherapy also is employed when, for example, it is necessary to have a targeted treatment of the cancer-affected tissues in order to stop the cancer cells growth, or to fully to destroy these cells. Also, we take a control over the patients prior to chemical treatment and afterwards. Also, we employ a multidisciplinary approach. We employ the new cutting-edge technologies, and it allows us to get very good results. Positron emission tomography, computer-assisted tomography is very normal today. For us, it's important to have intact our healthy tissues in patients, and this allows us to reduce any side effects. Also, we assess the status of the patient in our clinic. Actually, we have a very experienced team. They are very proficient, and they decide on the plan of treatment. Actually, prescriptions are based on this examination. Everything depends on the needs of the patient. Because it's important when doctors understand needs of the patients, and the person will feel very safe and secure. In our center, we treat the lymphomas, leukosis, multiple myelomas, Hodgkin lymphomas, aplastic anemias, myelodysplastic syndrome, solid tumors, ovarian, Jung sarcoma. In our center, we deliver the comprehensive set of services for the eye treatment, beginning from the pediatric diseases up to the diseases which normally we see in elderly. Our proficient specialists use state-of-the-art equipment. Normally, these are squint, amblyopia, retinopathy of premature, keratoconus, treatment of retina, diabetic retinopathy, degeneration of macula, glaucoma, cataract, refraction surgery, laser correction, excimer correction, treatment with intraocular lens. We have artificial lens. Presbyopia, this is the age, long-sightedness, multifocal intraocular lenses, contact lenses, treatment, transplants, ocular plastica. It is important to mention that in our clinic, we have international division. We have interpreters there, and it is important to say that all staff knows English. Some of our staff knows English and Russian.